Now it's time for Real Health Talks News and Views with cancer nutritionist and neurodevelopment specialist Craig Stelflew.
In the category of lifestyle, the nails are organs on the end of your fingers and toes. They reflect what is going on in your body with great accuracy. For instance, spoon-shaped concave fingernails are a condition called koilonychia. The causes of this condition include iron deficiency, diabetes mellitus, protein deficiency, exposure to petroleum-based solvents, systemic lupus erythematosus, and Raynaud's disease. Yellow nails suggest diabetes mellitus, amyloidosis, median ulnar nerve injury, thermal injury, and jaundice. Yellow nail syndrome can mean that the person has lymphedema and bronchiectasis. In the category of food and nutrition, studies are showing that as little as 10 extra pounds of body weight could predispose you to a tumor or a fatal heart attack in the future. A gluten-free diet is the best way I've seen lately to shed the pounds, eliminate inflammation, and generally lower disease and death risk. Did you know that celiac disease and gluten sensitivity can have a negative impact on reproductive health? Men and women with unexplained infertility, women with recurrent abortions, intrauterine growth retardation, low birth weight babies, and menstrual disorders are almost never screened for celiac disease or considered for gluten sensitivity. Best test for celiac and sensitivity? Cut it completely out for a while and see if you get better. In the category of medical madness, in the American Journal of Medical Quality, the researchers found that hospitals profit nearly 9 times more for treating infections that they caused. The hospital-infected patient spends an average of 24 days in the hospital. An ICU patient who develops a totally avoidable central line-associated bloodstream infection costs about 3 times more for care than the similar infection-free patient, topping in at about $400,000 per hospital stay. Each year, roughly 80,000 patients with central lines become infected, and some 28,000 of these die. Nearly as many people as die from breast cancer. A hospital's average profit for treating an infected patient is $54,906, compared to an uninfected patient, which tallies $6,506 on average. Bottom line, hospitals profit from their screw-ups. In the category of vitamins and supplements, pregnant? Think zinc. A pregnant mother gives a great deal of zinc to the placenta. Did you know that humans are the only species that do not eat the placenta right after birth? Zinc supplements are also advisable for nursing moms so that the mother's milk will not be zinc deficient. This is particularly critical for infant boys who require 5 times more zinc than infant girls for normal testicular development. Zinc-deficient males produce weaker and far less sperm than normal. Zinc-deficient mothers usually give birth to all-girl families. Zinc supplements improve fertility outcomes immensely. Never take zinc oxide as an oral supplement, only take zinc glycinate, gluconate, chelate, or other form of ATE zinc. And finally, in the Real Health Talk News and Views trivia, no coincidence trivia. People in Japan consume more than 12 milligrams of iodine per day, 50 times more than the average American. Life expectancy in Japan is just over 83 years old, and in the U.S. it is about 78 years. Infant mortality in Japan is half that of the U.S., and Americans have triple the number of deaths from breast cancer compared to Japan. Thank you for listening.
Thank you for joining us. You have been listening to Real Health Talks News and Views, featured every weekday on El Shaddai Radio.
If I could reach the stars